Good afternoon, and thank you once again for joining us for this update on COVID-19. I'm Dougal Saunders, joined today by the Mayor of Dubbo Regional Council, Stephen Lawrence, and also the Commander of the Arana Mid-Western Police District, Danny Sullivan. We'll talk a little bit about some of the vaccination clinics that are popping up, including the one that has started in Dubbo today shortly, and also some of the police activity and how you can help your community. But an update on the actual case numbers. Up until 8 o'clock last night, there are 38 cases across the health district. That's 38 new total active cases. Dubbo has 32 new cases. Wellington has 2 cases. Narromine has 1 new case. Walgett has 1 new case. And Bathurst has 2 cases, although there is also a recorded case at Bathurst from overnight, not included in these figures, which will be in tomorrow's figure. So Bathurst will move to 3. Total, as of 8 o'clock last night across the New South Wales district that we're in, the health district, is 232 cases. 9 people are in hospital currently, 2 are in ICU, and there is 1 person being ventilated at this moment. And that just goes to show that what we're dealing with here is a health issue, and very much our thoughts are with those people being affected personally, but also all the friends and family of those people being affected. 5,000 tests across the region, which again is about half where we were a few days ago. So the call out is again on today. If you have any symptoms, even the mildest of symptoms, or any concerns, please do come forward for testing. There is plenty of capability, and we're encouraging that to happen right across the weekend. Now on the vaccination clinics, obviously today is a big day. West Dubbo, Pioneer Park, has been open since 9 o'clock. People have actually been there since around 4:30 this morning. So in some cases, people have been waiting for 5 hours. Essentially, the message around the vaccination pop-up is it's pretty well booked out for the day. If you are not already there, I probably wouldn't go there now because you'll be very unlikely to be able to get vaccinated today. And the message on that is if you don't actually need to get your vaccination today or tomorrow, remember, that clinic is there for the entire rest of the week until Sunday of next week, the 29th. So there is all day, every day coming up this week and next weekend. So the weekend ones are really a chance for people that absolutely have to do it on the weekend to get a vaccination, particularly our frontline, our emergency services workers who maybe during the week don't have the opportunity. So if you don't need to be there today or tomorrow, please don't. There is literally a capacity of how many jabs we can get into arms, and we've already basically hit that today. We'll be doing the very best we can with health and the ADF to make sure we can do as many as possible, but at a certain point we are at capacity, and that's pretty much happening right now. So be aware of that. Don't go if you don't need to. Of course, we're encouraging everyone to be there, but there's plenty of time. Along with this pop-up clinic at Pioneer Park, of course, hopefully next week we'll be announcing a drive-through clinic which will take huge capacity and provide a completely different availability. There's still obviously the clinic which is available through the online booking system. It's now running 12 hours a day, taking more bookings for both Pfizer and AstraZeneca. Of course, your local chemist, your pharmacies are providing AZ as well, and your GPs. Keep looking for options as to what will suit you best. It doesn't all have to be done at one time at that Pioneer Park pop-up clinic. We will, of course, from Monday have the ADF working with health right across the region. More precise details of locations and times are still to come as it starts in places like Bourke and through the north and the west, and also places like Narromine, Trangie, Gilgandra. All of that detail will be provided as soon as we possibly have it to keep you in the loop, but be prepared for that. And if you're going to one of the pop-up clinics, just do be kind. It will be busy. It absolutely will be. We know that. You'll need your Medicare card and some ID, and be prepared for a bit of a wait. Just on the Medicare card scenario, I've had a lot of questions coming in. If I don't have a Medicare card, what do I do? If you're on a certain visa that you don't have a Medicare card, we're working through what the individual health care card identifier might mean and how we can work with health to make that a possibility as well. But again, you probably might just need to wait until next week, and we'll sort that through and make sure there are some options there for you. Wellington, of course, we mentioned yesterday, it will have its own vaccination clinic starting from Monday, 10 till 4. That's going to be happening at the Wax car park. It is for bookings only, And as of yesterday, there were literally hundreds and hundreds of calls to that number. Be aware that line is not open across the weekend. You can't book now. If you didn't get a booking yesterday, you'll have to wait till Monday. And look, that will be assessed as we go. If it is possible to transfer that into a walk-in clinic, that will be looked at. At the moment, it is for bookings. And again, please be patient. Everyone's trying to do the right thing. Hang in there and you will be able to get a booking, but not across this weekend. As far as the other vaccinations, as I mentioned, through the eligibility checker, or if you're looking at going through that Health Direct number, it's 1800 571 155, 1800 571 155, and keep trying on that. There are opportunities popping up all of the time. Testing clinics will continue as well. All of the testing sites that have been operational are remaining operational until we say anything different, and that's about the need to keep people getting tested, so keep turning up to where you are. We are aware of the issues around getting results. I mean, we've talked about that now for a number of days. It does depend on who you had your test with as to how you try and get that detail. The 1300 number we've been providing, 1300 066 055, is extremely busy and in some cases isn't able to provide you with the detail you might want. So if you're been a patient of Lavity, if it's Lavity that's done the pathology for your test, that is a completely separate number. It's 133936 and Histopath 9878 8173. We'll provide all of those details on this post, and that's the best way to get in contact if you've had testing through those particular providers. Venues of concern obviously is growing each and every day. There are more again overnight. They are all updated on the New South Wales Health website. Just do a simple search for venues of concern, look at Dubbo or your region, and they will pop up. There's a link to it in this post regularly as well, but please continue to share that information with people that may not have access to social media or the web. We again want you to be part of the community that distributes that information reliably to people who may not have it any other way. Look, the police, Danny will talk a bit more about police operations and unfortunately the fact that people are still in many cases doing the wrong thing, sometimes I think willfully, sometimes accidentally. Be aware police are absolutely trying to make sure that we all get to keep living our lives in the best possible way as safely as possible. So Danny can talk a bit more about that. Shopping is one of the things that's definitely high on the agenda at the moment, and as more of us are trying to do things like home deliveries or click and collect, there is clearly more pressure on all of our supermarkets in different ways, and they're trying to gear up and change the way they're operating to try and make sure that can happen. Be aware again that there have been scenarios where it's very difficult. Orders have had to be cancelled in many cases, and that's a really unfortunate thing. We're working very closely with Council and with the local emergency management committee to provide more support and opportunity for supermarkets and their workers. So hopefully that will help improve the situation. But do bear in mind you will need to be planning a bit more ahead of time than usual for your shopping, and if there are any sort of movements on that, we'll certainly let you know. But do try and plan and do try and be aware. If you are going to the shops, the supermarket, you need to be going as one person. This is not an opportunity for a family outing. It's simply for essential shopping, and that should be one person from your household. Look, I also just want to give a shout out today to, we've got so many people that are doing amazing jobs right across the region at the moment. Today I just want to mention the Western Primary Health Network. The PHN's been involved in lots of different parts of this behind the scenes at the front line as well. They've helped get some of the vaccines through GPs and clinics of all kinds, and also involved in that clinic at Wellington that's being set up. So thank you for that, providing PPE, coordinating some of the ambulance and other frontline workers. So to our Western PHN, thank you so much for being involved in what is a really big team effort. Again today there is a lot of information that I've already mentioned. We'll have some more from Stephen and also from Danny. Could I please ask you to try and find the information you're looking for either on this post right now or looking back at it later on today. There are lots of numbers, there are lots of different ways of connecting to things rather than just messaging constantly through to ask your question. Try and look for the answer first, because literally it's getting almost impossible to keep up with all of the questions that are coming through. Hopefully, most of the answers are being answered each day either verbally by me or with the posts we're adding as comments or posting on the site itself or through the Health District website. I would really ask you to try and find the answer to your question before you reach out, because we simply don't have the capacity to keep up every single day. We're doing our very best, I assure you. And the final message from me really is, keep doing what you're doing to support people in your life. That's community members, that's friends and family. Share the love, share the information as much as you possibly can. And remember, there is a way forward on this. We do need to work on it together. And I certainly thank you for what you're doing. I'll hand over now to Stephen to say a few words.
Thanks, Dougal, and good morning, everybody. Stephen Lawrence, Mayor of the Dubbo region. Not good news in terms of the numbers. Want to offer sympathy and support to all those people who have become positive to COVID-19. I've spoken to two of them this morning, and look, obviously everyone's in different circumstances. Some people very ill, some people doing okay, but I think the common factor is a lot of anxiety and isolation. So thoughts of the community are really with you. We are truly in a bad situation. We don't want to point to any particular trend from these numbers, I don't think, but obviously not good to see an increase. We need this incredible community effort to continue. So again, I want to praise the community effort that is going on from every individual who's staying at home and doing the right thing, which is basically almost everybody in the community, through to all these organisations, government and non-government, who are just doing so much to make things easier for people in a really difficult situation. We are seeing these continued problems with compliance, and Danny is going to talk about that in a moment. On Friday, when I had to go into the council building for the press conference, on my trip to council and then return to home, I saw police cars stopping 3 people, even just in that short trip. So everyone needs to be aware that the police are out there doing their job, and if you don't want your family member or your friend to have those sort of interactions with the police, then now is the time to reach out to those people, to reach out to the people in your circles who you know sometimes have a hard time complying with these things, because at the moment in the Dubbo region there is nowhere to hide. If you are out and about in breach of these orders, then you will be stopped. You might well end up in court, or you might end up with a very considerable fine. So again, we all need to be complying with these orders, and just as importantly, we all need to be doing what we can do to help other people to comply with these orders. A common problem that I'm getting in terms of feedback is these phone lines are sometimes really difficult in terms of getting through, and so is it so in terms of making appointments for vaccinations. You might sometimes need to continue to try throughout the day to make those appointments or to get through on the phone lines particularly. Myself and the CEO, Murray, would have been in discussions about what council can do to assist, particularly in terms of phone lines and so forth. So council is going to throw the necessary resources into making these things work as smoothly as they can. Again, just want to put out that call to the community for patience. There's going to be people lining up to get vaccinated. There's going to be people lining up in shops, and again, there's going to be people lining up to be tested. Everyone has to be patient and kind, and if this incredible community effort continues, then we will certainly get through this, even though we are indeed in a difficult situation. So I'll hand over now to Danny Sullivan.
Thank you, ladies and gentlemen. My name is Danny Sullivan, Commander of the Arana Mid-Western Police District, and I can report that New South Wales Police continue to work in partnership with all emergency services agencies in the area in support of the Local Emergency Management Committee in our job to enable New South Wales Health to combat this pandemic. The New South Wales Police Force and the Australian Defence Forces are continuing their wellbeing operation, working closely with the Local Emergency Management Committee to assist those in our community who need help. Finally, the New South Wales Police Force continues its operations under Operation Stay at Home. It's a very simply named operation in relation to compliance with the public health order. The name of the operation tells you what it's all about. It's about stay at home. That is the intent of the public health order. I'm very pleased to note that the majority of our community are doing the right thing. Our police have been out tirelessly in our public places and on our roads, both main and back roads, ensuring compliance. However, I can indicate that in the last 24 hours here in the Arana Mid-Western District alone, we've taken 49 legal actions against people in breach of the public health order. And that ranges from infringement notice all the way up to criminal charge and placing people before the courts today. All of those 49 legal interactions were avoidable. Please, do the right thing. Stay at home. The common theme we're finding is people looking for exceptions to the public health order to get out and about, rather than looking what the intent of the public health order is all about. It's about limiting our interaction with each other. This virus needs people. Each one of those infringements and criminal actions was avoidable. We're looking to everyone to do the right thing. We're certainly thankful for our community ringing in through Crime Stoppers for those that are doing the wrong thing. Let me assure you, your police are out and about in all our public places making sure there is compliance with the public health order. Stay safe everyone, and let's do the right thing.
Thanks, Danny. Thanks very much, Danny, and also to Stephen, the Mayor, and all of the support that we're receiving from everyone, including New South Wales Health, right across the weekend. We'll be here again tomorrow for another update. As I said, if you are looking for information, please try and find it in this post, in the audio. We'll have captions up later on today as well. Most of the information we hope you need is there. If you do need more, reach out. Stay safe, and we'll be back at midday tomorrow.